Cénica TV. Cénica TV.
Hola, ¿qué tal? Muy buenos días. Estamos aquí en Cémica 2018. Vamos a entrevistar a una ponente muy importante. Ella viene del Hospital Mount Sinai en la ciudad de Nueva York y vamos a platicar un poco de la alergia no mediada por IGE. Bueno, pues le presento entonces a la doctora Ann Nowak. Um, por fines, para darnos a entender, vamos a hablar en inglés. So, Dr. Nowak, thank you for being here and sharing your time with us. I want to ask you some questions, some brief questions. I don't know if you can tell us like a brief comments about food allergy non-mediated by IGE.
All right, well, thank you for having me. So my talk today was focusing on the three disorders: food protein-induced enterocolitis syndrome, food protein-induced allergic proctocolitis, and food protein-induced enteropathy, which represent the non-IgE mediated disorder spectrum. So they are relatively not well studied because of the lack of the biomarkers and tests, but they are increasing in prevalence and importance for clinical practice. The major points that, for my presentations are that each of those conditions have different presentation, different sort of acuity, and a little bit of a different natural history, although all of them are, favorable, and so they are being outgrown with age. Of those, proctocolitis is the mildest, and it's also probably the most common, manifesting with bloody stools in otherwise well-appearing infants. And this usually goes away by age 1 year. You reintroduce the food at home. For the enteropathy, the symptoms are more severe. Patients may have malabsorption, low albumin, low protein. There is villus atrophy on endoscopy. And the most common food triggers are milk, wheat, soy, egg, but it also goes away by age 2 to 3 years, and the food reintroduction is done at home because there's no acute symptoms. The food protein enterocolitis syndrome is an outlier. It's the most sort of dramatic manifestation of the non-IgE mediated food allergy, which can be a medical emergency. So unlike any other conditions, this is something that can land a child in the hospital requiring intravenous hydration or even life support. And it's an infantile disorder, so all of those conditions start in infancy, and it also is being outgrown, usually by age 5 years, although there are persistent forms, very unlikely, but they can be adults, as well as older children. And its major triggers is milk, soy, as well as rice and oat. Yeah.
Now, Dr. Nowak, the incidence of these diseases are high right now, right?
Well, so we definitely think that at least food protein-induced enterocolitis syndrome is increasing in prevalence and incidence. But in general, those are difficult diseases to study because there are no biomarkers. So it's really difficult to perform like population-based studies. I didn't show this data, but it seems that allergic proctocolitis is one of the most common causes of rectal bleeding in infancy. And up to 15% of infants may be affected by it, at least in the US. So I think that the prevalence depends on the country, the population, other factors. But there is evidence that FPIES, for instance, which was considered to be an incredibly, uncommon, very rare disease, is actually more common than we've previously appreciated.
Okay, doctor, thank you very much. Also, can you give us a brief talk about the diagnosis to reach the correct diagnosis and then give the correct treatment to these children, please?
So that's a very important point because you don't want to over or underdiagnose, right? So The diagnosis is based on the recognition of the symptoms, so the constellation of symptoms. For the proctocolitis, for enteropathy, there should be a trial of dietary elimination for at least a week or so, followed by range reduction, because you want to see the resolution of symptoms when you eliminate the food trigger with relapse of symptoms when you range reduce the trigger. So it's a diagnostic trial of elimination diet. Our FPIs, so depending on the severity, usually for the acute FPIs, we do not require a food challenge to diagnose it, but we perform those challenges to monitor the patients. But for the chronic FPIs, we do recommend a food challenge to confirm the diagnosis.
Well, I think that's it. Thank you very much, Doctor, to sharing your time here with us, and we're very grateful to have you here. Okay.
Semika TV.